So today we're going to talk about group insurance, kind of how it works, ideas on how to start. Mostly I want you to not be afraid, because I know there's a few of you who have had somebody go, hey, do you do group? And it's like, you kind of get the deer in the headlights, and I want you to be able to go, yes, I can. We can do group. Next week, we're going to talk about helping your clients with the high medical costs. If they maybe could have been in a CSR and they got an expensive bill, or just anybody. I mean, I just had an agent, person contacted him for Medicare. He starts Medicare in 3 months on April 1st, and he doesn't have insurance, and he just got diagnosed with cancer, stage 4, that he needs treatment right now. And he hasn't had health insurance in years. And we can't help you. We can't backdate it, and he doesn't want to wait a whole month, So I sent him the resources for that person. So it's gonna show you some resources for people with high claims. And then on April 18th, we're going to talk about the ICRA and QSERA. I know that one got postponed, but that one's kind of an interesting topic. It's sometimes how you can do a group for one, I believe, with the ICRA and QSERA. You're not really doing a group, but you're offering your one employee something. April 25th, EOBs. And then on May 2nd, the new recent legislative changes. So there's been a lot of them. Short-term is not the only one. There's been stuff with Medicare Advantage plans. No, I'm not going to talk about Medicare. I'm not going in that ballpark, but there's been lots of medical changes, and we'll just kind of keep you up on that. Changes with the telemedicine that I found pretty fascinating. So insurance is a hot topic, and when elections have come up, I thought it was going to be a hot topic again, and it's not. So it's really not the hot topic for elections this year. Now, who knows? We'll see. We got time before elections start. But today, I invited my friend Eric to come talk to you about group. He's kind of the person I go to when I'm like, I have a question about, I kept hearing, section 125, section 125. And I'm like, I have no idea who, where. So I'm like, Eric, what do I do about that? So Eric's the person I kind of go to, and he's kind enough to join us today. So Eric, I have a couple questions for you. How long have you had your insurance license?
Well, just recently. So the 19th of March was my 20-year anniversary of getting my license.
Okay. What insurance did you start selling first?
Well, it's kind of a weird story, but I did not want to do insurance at all. I went to an interview because I was looking for a job in IT, in the medical field. Not IT exactly, but anyway. I was looking for a job, and I was not finding what I wanted, and it was dragging on and on. And I started to get self-conscious about maybe I suck at interviewing. And so I started going to random interviews, and I went to an AFLAC interview, and I had absolutely no intention whatsoever of taking a job with AFLAC. And went to that interview, and I really liked the people there. And they went with that whole, our average agent can make this much money in the first year. You're above average, right? And that whole pitch. And I was like, well, I'll try this, because obviously I'm above average. I'll try this. as soon as I find the job I want, I'll quit. And so here we are.
20 years later, still selling insurance.
Right.
And I guess what is it that you keep selling? Why do you keep selling insurance?
I love hanging out with people, talking to people about solving problems. Really is the thing. I know that you're similar in that way. Just like people bring a problem to you that have no idea how to figure it out, and you're like, oh, well, just maybe I thought of this, and you're an amazing resource for them all of a sudden, just for one idea that you had, that you had this experience, and it gets easier over time to figure out how to solve people's problems. And I love that, just finding a kind of a puzzle to piece together every day.
They don't tell you that in high school, right? They don't say become an insurance agent, you'll solve people's problems.
Right.
And I think people don't realize how many problems we do solve, and it's in their real day-to-day stuff, right?
Mm-hmm.
It's not their some random thing. So, well, yeah. So take away, tell us about group.
Okay. Well, I'll just kind of go through briefly. Everybody feel free to ask questions. I'm going to open the chat bar so I can see those questions. Hey, Joseph. So like I said, I started with AFLAC, and I got really lucky. And I just actually had a meeting this morning with one of my first clients. We had coffee this morning. We were talking about this, and I didn't really think about how it's going to relate to what we're talking about now. But I'm in an area in Nashville. It's East Nashville. It's a very up and coming. When we moved here, it was a very up and coming. It was no place to eat at all, and now you can't go in, you can't go anywhere else because there's so many restaurants to visit here that I haven't even been to. But I started with Aflac, and it's all business to business, or it was at the time, and all these businesses were opening one after the next. So I was going to all these different restaurants, mostly restaurants and bars, and just like walking in while they're still building it out and being like, hey, because the training with Aflac was very like, here's some business cards and a stuffed duck. Go walk into businesses and talk until they either buy from you or kick you out. And that was literally like that was the training. Come back with 25 business cards today, that kind of thing. So I was walking, and I'm an introvert. So I was like walking in going, I'm here with Aflac, and I'd have to pause so they could say Aflac, nod and laugh, haha, that's great. And then who's in charge of your benefits? So it's kind of like just talk until, like they said, you sold or you get kicked out. And so then a lot of them were saying to me, we love this. This is great, but we don't have health insurance. How can you help our employees with health insurance? And I was like, I don't know. So I said, well, I'll find somebody else. I'll find an agent to help me and partner with. And I looked for an agent I trusted and liked, and I didn't find one. So finally I called Blue Cross and I said, how do I sell for you guys? And they were like, oh, just sign this document. You have E&O insurance. There you go. It's that easy. You guys know this. Just sign contracts and they're getting ready to go. There's not much training with the carriers a lot of times, unless you want to sit through like these videos and stuff. And so I was like, okay, that's great. So I didn't know what I was doing at all. But one of my Aflac clients said, I hate my agent. I was like, okay, why do you hate him? And they said, well, he's in Memphis, 3 hours away. I never talked to him. He doesn't answer my calls. Could you be our agent? I was like, I don't know. So I called Blue Cross again. I was like, hey, how do I take over this business? And they're like, oh yeah, sign here. I mean, that's the story, like 20 years of, oh, sign this document. Now you're good. But they were like, sign here. Got the AOR letter, my first group, and didn't think that much about it. Then I got the check for the first month, and I was, what have I been doing with my life? It was a pretty big business, pretty large size business, and the way better checks than I was getting from the Aflac business with them. So I was like, I want to do this all the time. And the rep, is still my rep actually now, at Blue Cross, I said, I want to do this all the time. And he said, well, you can't build your business just getting AOR letters from companies and transferring over. Blue Cross won't let you, and it's not a good way to build business. You need to you just need to go out and find your own clients. So I was like, okay, so that's how I started. So I started doing that. So I was doing Aflac, and I was doing individual, and I was doing group. That was the main stuff I was doing for a long time. And then Obamacare came along, and I was with Obamacare when it first started, and that was like everything all of a sudden. And so I had everybody on. Obamacare had hundreds and hundreds of clients, and Blue Cross decided that in the end of 2016, I got a letter that Blue Cross decided, hey, by the way, we're gonna step out of the marketplace in Tennessee, but go ahead and do your thing, that kind of stuff. And I was like, oh crap, I've got all my clients on this Blue Cross product. But I'm confident, and I've been here a while. By then, I was like, well, I'll just put them all on Humana and Cigna and healthcare. I'll just put all of my clients somewhere else. Well, then I got a letter or email from each one of them that said, hey, by the way, since Blue Cross is getting out of the market, we're not going to pay commissions this year. I was like, oh, so I've got a business model that's not exactly working, right? So I called the Tennessee Insurance Commission, and I said, I called them specifically about whether I could charge a fee, because I was hearing about you could charge fees. So that's what some of the agents in other states were doing, and I was basically told no, I could not charge a fee because I was getting a commission. I said, well, I'm not getting a commission. They said, well, actually, you are. You signed a contract that you're getting a 0% commission. I was like, oh, nice loophole there, right? And so
nice loophole.
So now I'm screwed, but also a lot of my clients were too, because they were on Blue Cross and they were getting out. So I I had to go through my client list and go, each one of them I decided I was going to go through them and help them anyway. Because it was either that or get a job, right? So I was going to help them anyway. So I started finding other products. I was going through my list and saying, okay, you maybe call Farm Bureau or call this, the solution. Maybe next year would be better. Just like kind of keep in touch, that kind of thing. But a lot of these people were business owners. And so I went through my list and found all the business owners and said, hey, you're losing your Blue Cross, but I can keep you on Blue Cross if you're willing to look at this group option. And I opened like 30 groups just that following year doing that, just saying, look, you're losing your current coverage. Here are your options with the individual market, or we can stay with Blue Cross, which in Tennessee is like Coca-Cola, it's like 80% of the market share. And you can stay on Blue Cross if we go to group. So we did that. I opened like 30 groups that year. The following year, Obamacare came back in Tennessee with Blue Cross. So I was able to start piecing that back together. But that was my roughest year in the business. I had all my eggs in that one basket. And so then I've just kind of built from there. So now half of my business is group and half individual. So the question is this a group or ACA meeting, James? This is an ACA meeting, but we're talking about how you can transition into groups.
Right.
Right.
So James, this was for people who were interested in group insurance, which is still connected to the ACA. Because I think, do you run into that, Eric, that people don't realize that group is also ACA?
Right. No, a lot of people don't realize that that group health insurance is ruled by the ACA rules. So they have no pre-existing, all the same options.
Have you run into the grandfathered plans with groups?
Not, I have, but they're few and far between now because rates change so much and people are always shopping.
Right.
And so you don't see a lot of group stuff anymore.
I see a few and then I'm just like, why are you still with this? But yeah. So what do you find easier, group or individual?
Individual is easier. Group I like better because for a couple of reasons. One is that you're dealing with hopefully 10 or more people at once, with a group, but you're only dealing with the HR person usually. So you're covering 10 lives or 10 families, but you're only dealing with the one decision maker. So I like that because it's more efficient, but it can take longer. Like I'm working on some groups that may not happen until July or August or maybe January because fourth quarter, a lot of companies want their plans to start in January. So, but I do like, the reason I like the group stuff, besides what I just said, is that it feels like an annuity where you're only dealing with them whenever they have a new employee or when somebody's leaving. So you're just like, throughout the year, you're just getting, hey, I just hired so-and-so, here's their application. And you can kind of do that at your leisure. Or these are the employees that are leaving at the end of the month, or I just had to fire somebody, and then you can deal with that too, because you've got 60, 90 days to deal with that stuff. You want to get on top of it as soon as you can because it affects their billing, but it's not so immediate that you can't just like group it all into one day or one morning or something.
So do you bring ancillary to all of your health?
I'm really bad about that actually. And one of the reasons I've got a good excuse that I let myself off the hook for is that lately I've been partnering with a lot of other agents. And so I have about 5 or 6 colonial agents, and I have some financial planners that work for like Guardian or some other companies. So a lot of these agents that feed me business sell the ancillary stuff. So I let them handle that. But I've been very generous. I continue to be very generous with other agents. So when an agent comes in, when a colonial agent calls me and says, hey, I've got this group for you, I'll split that to them on the contract through the carrier. So that they get paid on it as well, and they continue to get paid on it. I don't like to write personal checks for commissions.
Yeah.
So I like to write that into the contract with the company.
Right. So do you do referrals fees, or do you give them if somebody brings you a big group, do you write them just one check and you're done, or do you set up
I put it into the contract as part of the percentage, so they just they get paid even on the renewals.
do they have to be contracted with that carrier to get it?
Yes,
right?
but we'll work that out on the front end on that. So like I've got three different carriers that I use in Tennessee. So I've had agents that'll have them sign up for those contracts as well.
Right. I do that too. And I didn't think about having somebody that I pay a commission to, just having him get contracted. So that's a good idea.
Mhm.
So some of you that have thought about this, you've gotten this group plan, somebody who says, hey, I want to do a group, can you help me? You certainly can say yes, and then you can find an agent that sells group. I mean,
Right.
I've done that. I will work with, somebody else and either share a commission or write a referral, depending on how you want to handle that. If it's a one-up and I never want to handle group again, okay. But who would you, if you're Eric, so somebody brand new who somebody says, can you help me with a group? The answer should always be yes, right? And then who should they go to first? Do they go to their FMO? Would you go to the carriers? Like,
I mean, it depends. So like with Blue Cross, I'm contracted directly because I have been the whole time. I don't know that my FMO has the contract on that anyway. With Allstate, I'm contracted through the FMO. So in that case, I might go through the FMO to help me, or the carrier reps are the best friend you can have at the company. If they're good, I've got two really good ones and one that's mediocre. So like if I have a question, I can always call them and ask them to help. And sometimes they'll even be in on the sale with you. So I'm trying to look at the
yeah. So
questions and talk at
Ophelia
the same
said,
time.
where can I get training for Kaiser Group? Call Kaiser. That,
Yeah. I don't do Kaiser, but yeah,
Yeah.
call them directly.
Your carrier reps, it's their job to get agents to write their stuff. So they want to help you. So
Yeah.
if you want training on a group product and how group works, I mean, my first one was the big one, UHC. Man, that guy was all about helping me, right? He was showing me how to do the quotes. He was, hey, just send me the stuff. So that's their job. I mean, they want you to sell their product. Now, it can be a little tedious, at least for me, the first time I had to do a group quote. I was going to this carrier's portal and this carrier's portal and this carrier's portal and trying to get all the quotes together. And yeah, it can be a little cumbersome, but now I have one place I put all my quotes, I put all the info in and I get the quotes for everybody. So go to the groups. And then Ophelia, as far as individual, that's what this is. And again, your carrier reps. And if you want to talk about Walmart, that would be with Andy at North American. So keep your eye out with North American Insurance. The Walmart stuff is coming back after tax season. So Brian, you can answer Brian's. Can you provide some basis for reference for the comp on a normal small group?
Yep.
Small
So
group, and what are you talking under 50, Brian? Because that's 50 is
I wouldn't know.
Medium large.
Yeah, 50 could be different, but generally speaking, Blue Cross, I'm in Tennessee, so I sell mostly Blue Cross Tennessee and United Healthcare in Tennessee. Those two both pay per member per month, so it's like $25 to $30. And some will pay. I have to look at. I don't know the answer to this one exactly. Some will pay per subscriber, and some will pay per family member. I think it's Blue Cross who pays per subscriber.
Yeah, and United pays, level funded pays per employee. They don't pay for the family.
Yeah, so it can vary. And then Allstate is level funded, and I'm starting to sell a lot more of that. I've got maybe 10 or 15 of those groups, and you can negotiate. Well, I found out I had a meeting with Allstate this week. They came to Nashville, and it depends on your FMO. So some FMOs will let you negotiate the rates and some won't, but the base rate's about 5%, but you can negotiate that on, because when I quote Allstate versus my Blue Cross group, sometimes I'll see 30% savings. And that's what I'm doing with my marketing. When I go now to groups, they say, oh, I already have health insurance. Well, great, but I have a product that you probably haven't seen yet that I could save you 30% potentially. Would you like to take a look at that? And so that's been really amazing. And then sometimes you can take that, you can get such a big savings that you can actually negotiate your commissions on that and still save the money, which is win-win.
Which I just did. The Humana plan person, they've been on it forever. It was a grandfather. Humana's out, and I decreased their payment, and I got a 20% commission, and I'm still saving them like $1,000 a month in savings. So, yeah.
But I felt guilty doing that at first because you know, you always want to save your customer as much money as possible. But there's actually a good strategy there, because the following year on the renewal, if your renewal jumps up 8%, you have room now to bring that back down and give them, say, you can go up 8%, it went up 5%. You can move those numbers around. So I like that control, that you can kind of work with everybody and make the best possible solution.
I had a carrier, there was no rate increase. So I went, there's going to be a rate increase. I was only getting 5%. I moved it up to 8%, you know, so they on their 2% rate increase, they were totally acceptable of that.
Yeah, I think that's great. I don't think there's anything wrong with that. At first I did, because you know, like I said, you go into this business, you're just like, I just want to save everybody money. Well, we have to also make a living, and that's part of it. And if you give them the lowest possible rate this year, they could jump up 10%, and then you don't have any room to move it. And so it's good to keep it balanced.
How do you handle the regulation where we're supposed to tell them how much we make? Do you give them a document? Do you let the insurance carriers do that?
I let the insurance carrier worry about it. Yeah.
Asked or cared?
Nobody's ever asked me, but I've always let the insurance company worry about that.
Okay.
I've never really dealt with it.
We're supposed to tell them we make a commission, which I think is kind of funny, because I don't think anybody thinks we work for free.
Well, in the individual market, though, I get that question all the time. How do you get paid? I have a zero premium plan, and obviously you don't work for free. So what's going on here?
Right. And I always tell them I get $20 per member per month, and they go, "Oh, that's it? That's all you get paid?" I'm like, "Yeah, you know." But I don't think I've ever had a group ever ask that. So what do you use for your quoting? Do you have a platform? How do you handle your quotes for multiple carriers?
United Healthcare has a product or a website called Benefitter. I got that from my rep, and it's free, benefitter.com. I think you have to go to United Healthcare to get it. And so I use that, and I can quote everything except for the Allstate. And so I do. So I'll do that. I'll put the census in, and I'll put it into the Benefitter, and then I'll send it off to my Allstate rep. And as soon as I get all of those back, as soon as I have all of the things back, then I'll call the client and schedule that meeting.
And there are, because I know, Jill, you asked that, there are lots of these type of platforms that can do those quoting. There's Employee Navigator. If you contract with Colonial Life or Aflac, those are the ancillary groups that offer all the different benefits. They will give you access to theirs. My only issue with that is that then you have to sell at least one of the Aflac's ancillary to have access to their quote platform. So I have one that I use that's supposed to be connecting with Agency Block, call it Quote Plus, that has been moving around. I've worked with a couple different ones, but I hadn't heard about that one from United Healthcare. I sold United Healthcare, so I should find out.
Yeah, ask your rep about that.
Yeah. And was it, so yeah, Virginia's asking, how do you spell it?
I know, I'm looking it up. I think it's 2 F's. Asking me to spell.
And what do you mean by a benefit mall type place, Virginia? An FMO to quote all the carriers. I don't use an FMO to quote the carriers. So
okay, so maybe I don't have that right. So there isn't like a, you know, on a platform, I guess, is there a platform or a separate FMO you do for quotes or do you go to independent like UHC or Blue Cross and separately quote them out? Do you use is there a platform for group?
Yeah, that's what we're talking about. Those are the quoting platforms, and they're not FMO. They're just like Eric's using one that is created by United Healthcare. I use one that's just its own entity.
Quote Plus is what it's called? Yeah,
Quote Plus. It's Agency Block, which is our FMO, bought it. And so it's actually FormFire now.
Okay.
Or it was FormFire. Now it's Quote Plus, PLUS, quoteplus.com. It was FormFire, and then Agency Block bought it. But there's a lot of those platforms out there. I wouldn't buy one. Don't spend your money until you've got some momentum. You know, I mean, I went to Blue Cross, then I went to United Healthcare, then I went to Congress. Like I would send it to 4 different carrier reps and say, "Can you send me quotes?" And then I made my own little spreadsheet for them to start with.
And I still do that too. I still quote on the carrier sites as well sometimes. Because like with Blue Cross of Tennessee, I'll do it on Benefitter, but if I'm actually going to enroll them, I still have to go back into the carrier site and add the census info as well. And so I can talk about that. So when I'm talking to a group, I just had one yesterday, they called me out of the blue. And they said, can you help me with group health? Yes, absolutely. And so the next thing you need to get from them is a census. And so you can do this now. You don't need to be contracted or know anything yet. If somebody asks you if you can help them with a group quote, the first thing you need is a census. And the census basically, it's probably different, everywhere, but basically it's
I'll
name,
pull mine up and show it.
yeah,
Since I
name
have it right here.
and birth date. Sometimes zip code. You don't really even need the name because you could say employee 1, employee 2, employee 3. You just need to have like their birth date or their age, a list of the employees and their ages, because the ACA group plans are all going to be age-based rates. All states different because they'll have, you want to know male or female. And
This
then
is the
there's
one
these-
I use. I have
Mhm.
edited my request for group form. I don't even know how many times I keep editing it, but I have 2 tabs now. I have one for the employer portion to fill out benefit, contact person, their address, how many full-time, how many part-time, effective date. And then the employee portion, I've got mine noticed like what I have to have in order to run a quote. You have to know where they live and you have to know what their date of birth is. Like Eric said, I've had employee 1, employee 2, employee 3 listed because there are some people who go, ooh, I don't want to give you all this information. But you have to have their date of birth. You need to know their age. I've even had some just give me ages because they were afraid to give me the date of birth. So then I just went in and made everybody 1/1 of whatever year to make them the right year. And you can get quotes with just that information, and then come back. Now, I don't know, was gonna ask if Eric, do you want to explain the difference between like level funded versus ACA? Because there's 2 different, not just what they are, but also.
It's kind of weird because it's not even that different. The reason that it's better to do level funded, in my opinion, is that they do the health questions. That's the main difference, is they'll ask health questions of each employee. This is with Allstate specifically. I've never done a level funded with anybody else.
Right. They do, because I've done it with United, so.
So they'll ask the health questions up front, and then they'll base the rate on the actual health of the group. That's why can be 30%, even 40% less expensive than the ACA plans. The reason they call it level funded or self-funded, that I explain to clients, which still is hard for me. I've been doing the level funded product probably for 3 or 4 years now, and I still stumble through it. But there's 3 buckets. When the company sends in the monthly premium, the money goes into 3 buckets. One is for admin, so paying us and paying the Allstate admin stuff. The second bucket is true claims. So some of the money is put in a bucket for the actual claims that happen in the group every month. And the third bucket is the money that they're spending to buy stop loss insurance. And so every month when the group has a claim, it gets paid from the claims fund. At the end of the year, if there's money that's left in that claims fund, the group gets some of that back as a refund. If they've spent through all those claims funds that were put in throughout the year, then the stop loss insurance kicks in and pays the rest of those claims. So one of the biggest hurdles is that Allstate's product is called self-funded, and you say self-funded out loud and people go, because they think you're saying self-insured, and it's not self-insured. It's just a way that they show what they're doing with transparency, and also that they're using stop loss insurance to cover the claims. Whereas I think there probably is that as well on true group ACA level stuff. You just don't see it. They don't talk about that, and you don't know where that money's coming from, because these insurance companies have lots of money.
Level funded, they can get money back.
They can, yeah.
With their ACA, you're not going to get money back, but
No.
they're also not screwed if they end up having somebody with really high claims. That's
Yeah,
why
they're
stop
not
loss.
out. They're not out if something bad happens. I'm always grilling my reps about stuff like this. And I'm like, okay, what's a scenario where they could be screwed?
Right.
And my rep finally said, okay, one way that they could maybe get into some trouble with the insurance company is if they sign up, because they're signing up with a 12-month contract, they have a huge claim, they gets paid, and then they decide they want to go to some other company. They want to cut the contract. My dog wants to join in on this conversation. If they get this huge claim and then they want to jump out, the insurance company might not like that, and they might try to do something about that. But there's
And
no
they can't get
risk.
the money
risk
back.
otherwise.
And I learned this on level funded as well, if they leave early, doesn't matter if they had a healthy year. If they don't stay for the whole 12 months, they want to go to a different carrier. Maybe they want I have a company, they started 3/1 and they do not want a 3/1. They want 1/1 start date. And I'm like, okay, but you're losing any money you would have saved. And they're like,
Right.
to them, it was worth it. So,
Right.
Can I ask a question, Chris, on that? So if someone starts 3/1 and goes to the end of the year and they want to keep the money but start over,
they
can you
can't.
not work with the company if they stay with the company?
Nope.
Not with Allstate.
Not with
Not with
United.
Allstate.
No, you can't. Not level funded. You have
Not
to
level
do it
funded.
every 12 months.
Level funded. Okay, and then can I ask, when do you use level funded and when do you not? In other words, if it's 4 people or 5 people, do you not do level funded because the risk isn't spread out enough? Is that a good way to think about it? Or, one person gets cancer, you're tanked, or what does that mean?
It usually means you're not going to keep that level funded next year.
Yeah.
It usually means you're
still
going to
use
go
it.
to an ACA plan.
I would still use it if it saved them money this year. I mean, I would tell them what I think and tell them that next year we might be in the same boat.
And when you say an ACA plan, are you talking about Blue Cross Blue Shield and United Healthcare group plans?
The
Basically,
guaranteed ones, yeah.
Guaranteed.
they're
Okay.
different in all the states, but those are the two that I have here.
Okay, so
And I don't use those where I'm at. So it's your carriers that aren't level funded. So
that are not. And then, do you happen to have a grip on, like, I know a lot of people are like, oh my God, well, Blue Cross is the bane of our existence down here in Florida, but they also have the highest rate increases. So do you know is that just like market by market? Is there a threshold where you're like, never use these people? Nothing like that.
no, because that's market by market and state by state and county by county. I mean,
I have people here I'll never use, but that it's different really.
yeah. So I mean, I know if I just know my carriers really well. So if I get a group of 3 people, very small group, and they're like, I only go to Aurora, which is our huge network, then I'm like, I'm just going to quote you one company because they're so much cheaper than everybody else. It's not even worth sending all the information to the level funded. But to me, I don't know for you, Eric, but in my area, it seems like a group of 5 or more seems to be the sweet spot. If they're under 5, there's not enough pool for 3 people, or 4. 5 seems to be where it can be, where you can see that.
Yeah, and I thought of something else that I should have mentioned earlier. In Blue Cross of Tennessee, and it's different in every state, so you'll have to find out. Blue Cross of Tennessee will let me do a husband and wife group as long as they have their paperwork in order. So I can do, if they have like a partnership or an LLC, I've got a document for Tennessee where it says if they're an LLC, they have to do it this way, or if they have a partnership, they have to be on W-2. So like if I can, but I have the document. So when I was talking earlier about losing all those individual clients and finding people that had businesses, this was in my pocket. And so I was able to take this document and show it to the business owner and say, I don't know if you guys are an LLC or a partnership, but if you are, this is how you could do it. And if you're not, I know a lawyer that can set this up for you. And so we did that a bunch. I have 80 groups right now. And a lot of those groups are 2-person groups. So 80 sounds like, amazing. But a lot of them are husband and wife groups, which, don't pay that well. But at the same time, I have several of those husband and wife groups that are now 50, 60 employees. So they were starting a business and were on individual, but because we were able to put this together and now they can offer it to their employees. Blue Cross of Tennessee also doesn't require businesses to contribute for their employees' benefits. So
my state's 50% minimum.
So I've got this group. So I've got this company where I can offer a husband and a wife insurance on a group basis, and now they can offer it to all their employees, and their employees can pay for it themselves. So it's like, why not? And so that was a great product for me. That's how I built that.
So Eric, it's only Blue Cross. I mean, of course, in your market, but there are, for people that are 2, you go to the ACA. So for like, cause I work with a lot of small groups under 10.
Mhm, mhm.
I mean, that's kind of my market. So hopefully I'll grow that to above 10. But
Right.
I'm trying to figure out, do I do indemnity, the Philadelphia American? I know America's Choice is coming, is
Mhm.
level funded. The Allstate guy told me it's a little bit problematic if you're trying to do level funded with small groups, no?
I mean, most of my groups are under 10.
Or- I have
Okay.
I have 40 groups, and most of mine are under 10 as well. And now I don't put a 3-person group in Allstate. I
Yeah.
had one that they were willing to pay a higher premium to get money back because they were like, we never go to the doctor, we never go to the doctor, and they didn't for 3 years. And then one of them went to the doctor and had a heart attack, and it's like, all right, now the rates are just too expensive. But it's really. I would think one of the advice is, remember, they don't usually know anything more about group insurance than you do. So if you go in there starting off going, all right, this is how, this is how I think it's going to work, and you start doing it, they're not going to correct you. They don't know. You're just like the market, an individual walking into your company going, hey, help me find insurance. They don't know,
Okay, so but for smaller groups, are you better with like a non-ACA plan?
it depends on your market.
It really depends.
Oh, okay.
And they have to be healthy. You can't put a 10-person life where they've got 3 people with diabetes and,
Right.
chronic illnesses. You just, they're not going to take it. Now, if you have a group of 100 and you have 3 diabetics, okay, the pool's
Yep.
big enough to compensate for that. Level funded, I don't know, it can be more complicated when they do have to renew and there's something going on. Like there's somebody now that has an expensive medication.
Mhm.
I found another carrier that's all they do. It's a different, it's just for prescriptions. So that you could take a group that maybe has 100, but now there's 3 people with this, serious expensive medication. And I can sign them up and say, all right, have them all use this prescription company instead. So now the claims aren't going through their level funded and their rate goes back down. So, that's why I like problem solving. I'm like, Eric's kind of the same way. Like, we like to find those problems to solve.
Well, I had a group that I inherited because they were on Blue Cross or United Healthcare, one of them, and the rate kept going up, 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 up. So so they came to me and I got them on Allstate, and it was amazing, and they loved it. Everybody loved the coverage. They talked about how much they loved the coverage compared to their old coverage. At renewal, it was a large increase. And it was one of those when you see it, you're like, how is that even possible? Well, one employee had something that was very major and very expensive, and it messed everything up. So going back into that renewal process, we ended up going back to Blue Cross, where they came from 2 years ago. But they're happy. They're not as happy probably, but they're happy because I was able to explain to them why it went that way and why they were happy they were able to save money that year. And we went back to Blue Cross, and I found a product that was better than the product they had 2 years ago. It's still more expensive than the Allstate, but at least it was less expensive than the increase. If that makes sense. So you're constantly like still solving problems year to year because you can get ahead of that and you have different solutions available. I think that's important.
How do you
Eric,
handle your renewals, Eric? Do you just automatically send them other options? Do you just go, here's what your renewal is for your current carrier? Like, how do you handle it?
It depends because I have an idea what else is out there, and I'm trying to sell more Allstate because it's better. It really is. It's better. The deductibles are lower for the price. The customer service is better. So I like the Allstate product a lot. Plus, they pay better. So it's really like, for me,
Yep.
it's like I want to put everybody on Allstate. But it doesn't work for everybody. But the renewal process, Blue Cross and United Healthcare, they send theirs out about 90 days out. So I just got a bunch of them for, what is that, June?
Mhm.
July. Where are we? Where are we now? So I just got a bunch of them this morning in my email that I had to go through. So as soon as I have them, I will look and see. The first thing I'll look at is how much of an increase is that. Is it 5%? Okay. So if it's Blue Cross, I will take that and send it to Allstate and get a quote against it. If it's United Healthcare, I'll send it to Allstate to get a quote against it. But then I'll go to the group and say, here's your renewal. It's about 5% increase. I also have an alternative would be this other plan with Allstate. Let me know when we can schedule that meeting and talk about what you want to do. And so I'll try to get on to that as soon as I can. Allstate, one of the downsides with their renewal process, they only do 60 days out. So I have to hit that immediately when it comes, because 60 days sounds like a long time, but it takes the group about 55 days to make a decision.
Yeah. And then they want to change.
And then they want to change it. And so you have to get on top of it.
I would say, Rosalind, you asked what's the learning curve for someone very familiar with ACA and Medicare. I don't think it's much of a learning curve. Now you're just learning a portal, right? I mean, the deductible is a deductible, a copay is a copay. You know what an HSA is. The learning curve is not very big. And then I know Joel asked, you know, for someone who's figured out how to prospect ACA, Medicare pretty well, how to prospect group.
Well, there was a question earlier that I was going to answer as well about basically the same thing. It's going to be different for everybody. For me, it was, I started my business with Aflac, but I didn't have any money at all when I started. So everything I did was networking. I went to every networking event I could find, especially the free ones. And then here's the secret to leadership. This is the secret. Express interest in being a leader in a group, and they will hand you the keys. So I was like, you know, I'd be interested in being on the board of that. And you'd be like, you're president. And everybody wants to talk to the president of the organization. It doesn't matter what it is. If you're in charge, everybody there wants to talk to you. So I did that. I led my neighborhood association, the merchants association, the chamber, several chambers, and I'm an introvert. I hated it, but show up with business cards and stand by the punch bowl and whatever. And so all my stuff now for 20 years has been word of mouth. So I tell people I do group, I talk about group, I mention it to everybody, and then pretty soon people are going, hey, don't you do group health? And so that's kind of been the deal. So everything is word of mouth. And all the clients I get now come from the colonial agents I mentioned earlier, or financial planners, or people from the neighborhood, or people that talk to somebody that's a client of mine. I don't do any cold calling anymore. I don't walk into businesses anymore because I don't want to.
Because you're an introvert.
Because I'm an introvert. But that's how I started. I mean, that is literally how I started. And I was scared to do it. So another secret was that since I was on the neighborhood association board, we had a newsletter. And so I took the newsletter every month and I hand delivered it to the businesses that I wanted to meet. Because I was scared of the insurance thing. I didn't want to be the creepy insurance guy, the Ned Ryerson or whatever. I wanted to be taken seriously, but I also wanted to make relationships. So I would hand deliver these newsletters and say, hey, I'm the president of the neighborhood association or whatever. And by the way, you know, who does your health insurance or those kinds of things? Or they'd say, or aren't you the insurance guy or whatever? And so it's
word of mouth. I mean, I am a network. I do not do marketing for this. No, I do now because I have other agents because I hire, you know, I have LOAs. But it was networking. It was just like Eric said, I'm now the president of the BNI. All right, you know, and chambers are cheap. And then go to every Vibe at 5, every event they have, and people just start seeing you. And I got somebody who called me to come out and do a group. And how'd you hear about me? And they're like, oh, this other company, Oosberg Concrete, told us you're the person for the trades. I have never talked to anybody from Oosberg Concrete, not once. And I was like, yes, I am. I am the agent for trades, right? Like it's amazing how it'll start. So there's a lot of options out there, but you have to be out there. I've got one I'm going to show everybody and I was telling Eric about this. I have a new group benefit that I think is pretty awesome. To me, it's a win-win for everybody. So I'm going to do a screen share to show you. And I just made a quick video so I can start sending this to employees or employers as I'm trying to show them this benefit. So this benefit is called Safe Harbor, and it saves on average the employer $500 of payroll tax a year per employee. The employees also save on payroll tax because this is run through as a Section 125. But it's kind of they use two tax codes. The employer pays for it, and then you get the money back, which is the second tax code, which I can't remember. It's like 1643B or something. But the employees have access to all of these benefits. And this one right here is their number one, 0 copay mental health counseling. It's unlimited. They can have the same carrier or same counselor once they find one. They don't have to wait, because the average wait right now is anywhere from 3 to 6 months or longer for mental health in your local area. It comes with the EAP program, which I didn't know anything about this. I had a carrier or a company, Humane Society, who kept talking about this. We need an EAP, we need an EAP. So I went, all right, I'm gonna find this EAP program. And it was built in to this wellness package. There's wellness challenges. So my staff, I got this for my staff. I've already got 4 clients, current clients signing up for this, for the wellness benefits for their employees, but also the savings. So the wellness challenge, you can challenge your coworkers to see who walks the most. The EAP program here has just tons of stuff. Aging as yourself, but also taking care of like their caregivers and taking care of your parents. A lot of us have millennial and the Gen X's, right? We're squeezed between elderly parents. There's mental health, there's wellness, working stuff, living, all of these different transactions. And I have a group that has a lot of immigrants, and right here, they have a program right here, immigrating to the US, that will show them how to come here. So this program doesn't cost it doesn't cost anything. How I explain it is, if they can find you $700 a month or $700 a year of savings, is it worth you paying them $100? Well, yeah, right. And that's what it is. They're saving them money, and they're using that money that they're saving for to pay for it. And it basically, everybody's paycheck goes up. And then I sell ancillary. So Eric has great relationships with Aflac, and you can do that as well. That is another way. Find your Aflac rep, find your Colonial Life rep, and build that relationship. I let the Colonial Life do all the work, and I get a little percentage over the top, because he's on it. He gives everybody his cell phone 24/7. And if it's a group under 10, it's not even worth me trying to find quotes for something else. I had Aflac, they've now come back into my life, we'll see. So I will let them. And then if I keep talking to them and I'm giving them that, then when they find a group, they'll send it to you. So you don't have to go get a job at Aflac to connect with Aflac or Colonial Life. Those are the 2 companies that they're very similar. One just doesn't have a duck.
So Chris, on that, so it costs each employee $100, or it costs the employer $100 a month?
It doesn't cost them. Their money goes up. They find money, and they keep some of the money they find, and they give most of the money back.
Okay.
So that's,
It
I'm not
has
gonna
to
go
do
into
with,
the details. If you want details, I'll be
No,
happy.
I'll call your guy at Safe Harbor.
Yep. So
it has to do with pre-taxing, something about taking the money out before they get taxed on it, then they get it back.
and then they get it back after. So it's all about the payroll setup.
Okay.
So
It's a
I
loophole in
think
the
Jill's
tax
got a scenario.
thing.
What'd you say? For example, a group of 10 comes to you all healthy. Step 1, what do you quote and how do you quote? A group of 10 not all healthy. What do you quote and how do you quote? I know it's dependent on where we live. So Eric, what are your kind of just basic steps for groups of 10, healthy and unhealthy?
A lot of times the group doesn't know how healthy they are, how healthy their people are. Sometimes they do, sometimes they don't. So it depends. So I'll say the healthy thing. I'll just say I'll say it's really great if your group is healthy. Now, if you've got somebody in there I'll say this. I'm very casual. Kind of like now, but I'll just say if somebody in your group has cancer or heart surgery or something, I'll say it's not going to be a good fit with your size of group. But I still will try to quote it, I think, because sometimes even with the unhealthy, the rates are so much better, at least in my area, that sometimes even with an unhealthy person in your group, the Allstate quote still comes in better than the ACA level stuff, or the ACA no, I shouldn't say level, but you know,
The guaranteed issues,
yeah, the guaranteed issue. So it's not that different as far as the quoting. So what I'll do is I'll just get the census, and I'll take it to the carrier and get the quotes back, and then I'll spend some time looking at it and just figuring out what the differences are. And I'll take all the quotes back to them. I'll say, you know, here's Blue Cross, here's United Healthcare, here's Allstate, and these are the reasons why this one's better than this, or this one's, and the beauty is I'm selling all three. So if I'm showing them three different companies and they pick one, I'm still winning, right? And so it doesn't really matter to me what they pick, just as long as
Yeah,
they
I
pick
show
me.
them, you don't, I don't quote differently. You know, unless they tell me it's a group of three and they got somebody with cancer, well, then I'm not even gonna worry about Allstate, but
Right.
you're gonna bring them more than one quote, just like you should with your individual.
I get myself in trouble sometimes because I've got a group that's on it's a Cigna plus Oscar. And I inherited this. I took it over from another agent and I hate it. I hate it, hate it, hate it. And it's an EPO, a group plan on an EPO. I hate it. So every time I get a chance to quote against it, I do, because I've had it for several years. And the first year I tried to quote it against Allstate, and I preached Allstate, and I was just, this is going to be the most amazing thing ever. I had one guy that had heart bypass surgery, back surgery, and cancer in the same year. It was just like Allstate looked at it and they didn't even quote it. They're just like, well, no.
Right. We're not
So you
doing
gotta do some study ahead of time. But generally speaking, I don't ask a lot of questions.
Do you ask questions at the front end? I mean, I guess if brand new person calls you, says, hey, I'd like group insurance. What is your basic overall questions to start?
I'll say, what are you doing now? What's your situation right now? Why are you looking now? Or have you been looking a long time? Those kinds of things. Because a lot of times people won't call you usually until they have a problem. Or if a guy calls you, it's because his wife told you to call you.
Yes.
So like, what are you doing now? Well, we have Blue Cross, but it's terrible. Or we've been wanting to offer it, but it's too expensive, or whatever. And I'll just kind of talk through that and kind of, okay, great. I just agree with everybody. Oh, I see that. Yeah. Okay. Well, I can fix that. So.
The
And the
answer
other thing is,
we can always fix it, right? Doesn't matter what
yeah,
it is.
right.
We have a
And like,
solution.
and my thing, this question keeps kind of coming up, I think, on this chat is like, how do you do it? Ever since I started, it's been, can you do this? And I say yes. Right. And then I hang up and call Chris, or I hang up and call Renee, or I hang up and call Andy, or whatever. Yes is the answer. So today or this week or next week, when they say, can you help me with group, you say yes, and you call me or call Chris or call whoever, and we'll tell you how to do it. It's really that easy. It's not that easy, but that's the first step. It's just
Say yes.
because
We'll find you the resource.
the confidence is the thing. Like if you can walk in there and be confident, you'll sell it, even if you don't know anything, because they don't know anything either. They're looking for a solution.
I'll show you, this is my intake form that because I have a back office person who helps me with small group, because to me, the longest part is the quoting, getting the quotes out. I'm just like, ugh, I want her to get that all together. So she sets up my appointments. This is what we ask, and I will attach, just so everybody knows, I will attach this, and the spreadsheet that I shared will be with when I send out the information. But just their basic, what's their type, full-time, part-time. I learned a long time ago to ask if they have local full-time people not in the area, because let me tell you, I quoted somebody thinking they were here and they had one person that was like not anywhere close by. Payroll frequency, most recent payday, because this is stuff that works with the ancillary, not so much with the health. Do they currently have benefits? Is their first time looking? Do they prefer a network? So this is my kind of basics. They don't have to fill everything out, but if they're willing to answer all of this, then at least I have an idea. But I'm still gonna, when I talk to them, go, all right, what do you need? What are you helping? Because I think, and Eric may have a different view on this, but sometimes they ask for something that they don't need. They think they need something, and that's like, no, you need this. But what is it? What's the need that they're trying to solve with what they're asking for? Is it employee retention? Is it employee, hiring people, right? They can't hire anybody till they have health insurance, so that, that kind of stuff. So I like to, what is it? I want to talk to them and find out what it is that they're actually trying to solve, and then give them the solutions. But I don't talk people out, because I've tried to talk people out of something that was a bad choice, and then they just went somewhere else, and I went, okay, or they didn't do anything. And like, if
I do that with dental insurance sometimes. People call me to buy dental insurance, and I talk them out of it, and I'm like, stop doing that.
Right. Yeah. So if that's what they want, okay, give them whatever they're asking for. I mean, I had a group that he wanted health insurance, and they don't pay their people enough. I mean, on the marketplace, everybody qualified for silver CSRs. And I'm
Yeah.
like, why would you do a health insurance? Like, you shouldn't do health insurance. Everybody, I mean, he even had his daughter. She's like, yeah, I'm on the marketplace. It costs me $2 a month. Like, I'm like, I can't get you health insurance that's this good. But they had one person they wanted to hire back for health insurance, and they have completely, I never did give them the quote. I just said, it's going to cost you around $250 a person minimum. You know, I was trying to tell them, and then I've been ghosted. I have no idea what they did, and I should have just given them what they wanted, and then let them to make that decision.
Oh,
Hey,
you
Chris,
learned.
do you all of your, or Eric, do you use the, family glitch calculator, the taking businesses and deconstructing their group plan kind of idea? Like with,
Theoretically.
I did.
I don't actually do the calculator, but theoretically, yes. So like I had a meeting this morning. I coffee this morning before this meeting with, he's one of my first Aflac clients. He's a friend of mine now, and but I haven't seen him in a long time. He just bought 3 restaurants that from his former boss and blah blah blah. So we were talking all about that, and he really wants me to be the insurance guy at his restaurants. The problem is his workers all work for tips. And so we can't do something through payroll because we've tried that before. They don't actually get paid enough to get payroll deducted. And they also make enough, like on paper, they make about the right amount of money for Obamacare. So it's been a problem for them forever because they want to offer insurance, but it's just not feasible. And I said, why don't we do this, which I've done a ton of other places, is I will come in and be your group health rep, but I will talk to them about individual coverage. Right. So it's like you can approach these in lots of different ways. You can be the group health rep but sell Obamacare, or you can set up an ICRA, or you can, work with the management, set up a management carve out, which is basically just right into the contract that the insurance is only for managers or above.
Or salaried, or
Salary, right. And so there's lots of things you can do. You learn as you go on all this stuff. But again, my thing is always just say, yes, I can do that. Figure it out.
Correct.
Later.
Say yes, because you can. Now, you might have to learn. But I think group in that respect is a little bit easier than the marketplace sometimes, where you can go, yes, I can help you, go away now while I talk. Groups aren't expecting you to sit down in their office and give you their rates right now. They know that there's time, that there's lag for you to kind of reach out and talk. So, and then Jill, you said, so far what you understand is 1, get a census from the employer regarding the employees, 2, talk about health and needs, 3, reach out to carrier reps for quotes and present the quotes, mention ancillary products. What are you missing? That's pretty much it. I mean,
you can go with the rep, go through the quote yourself and make the rep present to you as if you're the client and they're the salesperson. They'll do that. If you get a good rep, they'll do that.
Yeah.
Our reps, I call them every day. Some of them.
Get to know your reps. And I would say group reps are probably more responsive, right, Eric, than the individual.
I don't know who a lot of my individual reps are, anymore. They change a lot. There's a lot of turnover in that for some reason. And like my Blue Cross rep, I've got 2 of them. So one of is on the sales side when he's first selling it, and then after it's sold, it goes to someone else. I've had both of those guys for at least 15 of the 20 years. One I left and came back and blah, blah, blah. But so they know me. We talk all the time. We got to lunch, stuff like that. My United Healthcare rep, I don't know what she does. Because every time I ask her for anything, she tells me to check the online guide, or it's really frustrating. Allstate, Will is amazing. He was just here in Nashville and took us out to lunch.
Yeah.
I call him all the time. Even like stuff, you get to the point where I could call my Blue Cross rep and ask him a United Healthcare question, and he doesn't care. I mean, he's trying to convince me to sell Blue Cross, but like we'll talk shop, and it's fine. So that you really want to establish those relationships. They're the ones that taught me how to do it, really. Because I'll ask the dumbest questions. And I'll even say, I know this is a stupid question, I should know the answer, but what about this? And they'll say, no, that's a great question.
So yeah. And you can use FMOs. Sometimes you can go direct. It kind of just sets up. And then last question, because we are at the top of the hour, we got to go. Krishna said, are the products only selected by the companies or the individuals? Do companies prefer carriers? It's going to be individual. Like everybody's different. I may say United Healthcare to somebody and they're like, absolutely not, under no circumstances am I going to work with United Healthcare. Oh, okay. And then some are like, who's common ground? And then I tell them. So the group is going to select that. And then as far as the ancillaries, you're going to have to, every carrier is different. Some companies I mean, my Colonial Life guy, I love that dude. He's been here forever. He's a career guy. He handles all of the claims. So I have there's no lack of confidence giving him groups. Other carriers, I don't know. How responsive are they if there's a claim? So you're going to have to kind of learn. If they're really good with you on individual, they'll be really good with group. If they're not so great with individual, I don't know. Will they be great with group? So I know we could talk more about group because it's a totally different topic than we've talked about before. Thank you, Eric, for sharing your information. For those that didn't see it, he actually gave out his phone number. It was 615-478-7146 for those that listen and don't actually watch the videos, because we do have some people who do that. And his email address is Eric, ERIC, Jans, JANS, @ericjans.com. So thank you, Eric. I appreciate it so much. Are you coming to the conference in Texas?
Yes, I'm actually going to the Medicarians conference on Sunday, so I'm excited about that
Okay,
too.
so if anyone's at Medicarian, say hi. The conference, in North American conference, be in July, and I will see you there.
Yep.
Thanks,
So how
Eric.
do you,
Thanks, guys.
I know you're wrapping up, but like, how do you get through potentially like the ADPs and the benefit managers, payroll companies, etc.? Or am I like way too thinking way too large?
No,
That's why that networking, personal.
that's great. No, I had one with one of those companies. I can't remember which one, that I absolutely loved and gave me all kinds of business. Then he left and went somewhere else. So it feels like you're constantly replacing those people because there's a huge turnover. But yes, absolutely.
Personal, if the HR person knows me personally, they're going to be much more aligned to go with what I say than the ADP. So.
Awesome. Thank you.
Yep.
Thank you.
Thanks, everyone.